Welcome everybody to our webinar. We're just going to get started and allow the participants to come in, as well as we're going to get started on Facebook Live. So hold tight and we'll be with you in a moment. Welcome everybody. We're just assembling, so please hold tight while everyone gathers. Hi everybody, welcome. We're streaming live now on Facebook, as well as we're on Zoom. And just to let everybody know, we will be recording this particular webinar. We're going to get started. We're going to continue to allow people to follow us, and then we will get started in about 30 seconds. Thanks everyone. So welcome everybody. My name is Judy Mark. I'm the president of Disability Voices United, which is an organization directed by and for people with disabilities and family members. We have been holding weekly webinars since March 19th. So this is like our 1 millionth webinar, or at least it feels like our 1 millionth webinar. We have been quite active in this space of representing the disability community in around coronavirus advocacy, and really want to welcome everyone. This webinar will be recorded, and we will give everyone a chance to ask questions through the chat. But before we move forward, I wanted to let those people who need Spanish interpretation know how you can access that Spanish interpretation through an outside line. So I'd like to introduce Lorna Silva, our fabulous Spanish interpreter, to speak in Spanish and let folks know. Go ahead, Lorna.
Para las personas que necesitan interpretación simultánea al español, llamen al 551-241-6310. De nuevo, 551-241-6310. No se necesita código de acceso. Gracias. Thank you.
Thank you. So welcome everyone. Today's topic is called, it's part of our series that we're holding. This is our third one around opening up in a pandemic, the perils for people with disabilities. This particular topic is called Staying Social Inside and Staying Safe Outside, Ideas for Activities and Human Connection During the Pandemic. 2 weeks ago, we had a town hall of individuals and families telling us how they feel about the re-entering, the reopening, the re-engagement. These are all things that DDS has been calling the reinstatement of group programs, and how people can start accessing services. And I've been very frustrated hearing the discussion about it, because they keep saying, oh, we're re-entering them. People want to restart their services. But there's been a whole bunch of providers, some of whom are on the call today, who've been providing services all the time, particularly those in supported living services, who have had to take a huge amount of additional work because many of the individuals they support go to day programs or to employment during the day. And so we want to do a major shout out to those workers who have been out there on the front lines every single day. We have some really amazing presenters, but before we do that, I wanted to tell everyone how you'll be able to engage with us on the webinar today. There's going to be 2 ways. The first way is that if you have any questions about the technical issues around Zoom, you can put that in the chat, and our wonderful program assistant, Ed Herzl, will respond to you. Or if you have ideas that you just want to share with people, put that in the chat. If you have a question or a comment that you would like me to read to the presenters today, you should put that in the Q&A. And the way you find Q&A is by going to the bottom of your screen and clicking on Q&A. And that is a way that I can really focus on what your questions are. And once they're answered, I put them into the answered section. And it's a way that I can make sure your questions are answered or your comments are read. If you put it in the chat, it goes by too quickly, and I will probably not catch it. So please make sure to put it in the Q&A. We're going to be discussing a lot of things today that you might have questions on. I actually just got a whole set of questions about participant-directed services emailed to me right before this call. So we are already getting started with that. So let's get started with our webinar. And I want to introduce our amazing intern. Yes, we have a lot of amazing people today. I keep using these superlatives. Our amazing intern, Ishita Tripathi, who is a just recent few-week-old graduate of UCLA. And she took my class at UCLA and is now interning with Disability Voices United. She's on her way to medical school next year and is working with us on a number of projects, in particular how people with developmental disabilities interact with the healthcare system. And she and our organization have produced a tip sheet that we will make available to everyone through our coronavirus website, which we will put in the chat if you don't know it, but it's disabilityvoicesunited.org/CV or for coronavirus, and we will have it up there. But we wanted to share this tip sheet with you that you can print out and bring with you to doctor's appointments, to the hospital, to emergency rooms if needed, on how to treat patients with developmental disabilities from the perspective of people with developmental disabilities and their family members. So Ishita, take it away, and I know she's going to show you something on her screen.
Okay, so can you see this all right?
We sure can.
Okay, awesome. So I'm very excited to share this resource with everyone today. So as Judy mentioned, we've created a tip sheet for healthcare providers that encompasses general practices for interacting with people with intellectual and developmental disabilities. And this was created based on input from self-advocates and family members in our organization. So I'm not going to go over the specific tips here, but it generally includes topics like presuming competence, making accommodations, adapting communication styles, and many more. But a lot of healthcare providers don't specifically get training in working with their population. So this is a really quick resource for them in emergency situations, surgery centers, or even in regular healthcare visits that we're hoping will help improve the quality of interactions. So on our end, we're going to be sharing this with hospitals, doctors.
I'm sorry to interrupt. First of all, can you just slow down a little bit for our interpreter? I'm the worst. I talk very fast. And could you make that your full screen? By clicking the green button, and that way we'll be able to see it a little bit bigger, possibly. The green button on the left.
You're gonna have to direct me. Oh, this.
Yes.
Yes.
I think that might make it a little bigger. Well, maybe not. Maybe you can zoom in. I just think it'll be easier for people to see. There we go. Perfect. Thank you.
No problem. All right. So, where was I? So we will be sharing this with hospitals, doctors, and administrative staff and working on increasing training and awareness from our standpoint. But in the meantime, we really recommend that all of you bring this with you to any of your healthcare visits and give it as a preliminary document when you're checking in. You can just say something along the lines of, I have some materials here that I would like the doctor and other healthcare staff interacting with me or my child to quickly review, and this might help them better understand my preferences for communication and care. So we also recommend attaching this to the healthcare passport. And I'm going to switch over and show you guys that. This is already on our coronavirus website, but we'll re-upload it attached to this webinar for you guys as well. So this is a quick resource that you can fill out that just shares your preferences for communication, your medical history, what medications you're taking. And so there's many different versions of this online, but we believe that this is the one that's most person-centered and empowering. So this is going to be uploaded on our website as well. So if you bring this along with the support document that we've created, we're really hoping that that will help the staff better accommodate you and support you throughout the visit. So yeah, these are just really some quick resources. And if you have any questions, let us know and we can answer any concerns you may have about these tools. Thanks.
Thanks, Ishita. That's great. And so we want people to understand as you are interacting with the healthcare system, and we know that that's not what this whole topic today is about, but because this resource has just become available, we wanted to talk about it, especially as coronavirus cases are radically and rapidly increasing in the state of California. We wanted to make this resource available to everyone. And that you have this health passport filled out in advance. Do it while nobody's sick. Do it while everybody's okay, so that if you are in an emergency, you can literally have it printed out. It's part of anything that is in your purse, in your pocket, in your backpack, and you can bring it with you into a healthcare setting, whether it's a doctor's office, an emergency room, or a hospital. And so speaking of hospitals, I want to introduce our next presenter, Brianna Doherty, who is a PhD in something really smart like neuroscience that I can barely understand. So we already worship you, Brianna. But she's also a medical student at UC San Francisco, a really incredible med school. Where she's focusing on developmental disabilities and mental health. And she's also created a really great tool that you all could use, as well as has some general advice from a medical perspective. So thank you and welcome, Brianna.
Hi, thank you for having me. I first wanted to say I apologize for wearing a mask. I'm actually working in the hospital right now, and so I'm required to wear a mask at all times. So I hope that doesn't, I hope that you can still hear me and understand me okay. So let me share my screen. Okay. All right, can you see that full screen?
Yes, we can.
Great.
Well, actually, we're seeing if you could start the slideshow, it's probably best.
Start the slideshow.
Yeah.
Is it not happening?
Yeah, because we're just basically seeing the presenter's view.
Oh, okay.
So go up to slideshow and then click down to start.
Slideshow.
And then say from beginning.
I thought that's what I had done. Is it working?
Oh, for some reason we're seeing it all. I mean, you might, because you probably are doing it through presenters, but it's okay. We can still see it. It'll work.
Brianna, you may need to, this is Ed, sorry, I'm the admin sort of this. I help Judy with that side of things. If you could go to the share screen button, you may have to, there may be the full screen view somewhere in there that you can select, would be my best guess.
Okay, I apologize. I haven't done this before. So maybe if I just do the screen, share the whole screen like that, so you can see my whole screen. And then.
Oh, no, that's not it.
Yay, perfect.
Got it.
Does that work? Okay,
yes.
Great.
Perfect.
I apologize for that.
No worries.
Okay, so I'm going to be talking about the state of the pandemic and where we can go from here. So I have to say up front that I borrowed some material from Dr. Clarissa Kripke, who has spoken on other webinars. So some of this material may look familiar. So how does a pandemic end? So the first option, and to be very blunt, is it continues until everyone susceptible is infected. If getting infected makes people die or become immune, it will eventually peter out. And the problem with this option is that there are 8 billion people in the world, and that's a lot of infections, and millions of people will die. Additionally, if getting infected doesn't make people immune, it won't peter out, even if everyone is exposed. And more research needs to be done, but recent data is suggesting that immunity after infection is not lasting as long as we would hope. So we clearly shouldn't rely on this option. For the second option, we contain it with testing, contact tracing, and quarantine. So this is what many countries are doing at the moment, getting the numbers very low so that it is practical to find every case and make sure it doesn't spread. However, in the US, we currently don't have enough political will or leadership to make this happen outside of a few communities. And the third option is it becomes endemic, like the flu, and we learn to coexist with this virus in the long term. So where are we in the US? As you can see from this image, we are not on the path to control. We're on a path to having to adjust our lives to living with community spread of COVID because it's not being contained. The direction that the US is heading now will not only, we will not be able to go back to our old lives for the foreseeable future. So we're going to have to figure out how to make our lives manageable and productive without getting exposed to COVID. And this is going to go on until there's a vaccine or a widespread treatment, which some people are predicting may take years. So what did the data show about the intellectual and developmental disability community? Again, there's much more work that needs to be done, but the data that we have suggests that people with intellectual and developmental disabilities are getting infected and dying at higher rates. And those living in large group settings and institutions are at more risk. And there are many structural factors at play here that will be important to unpack moving forward. So given the state of the pandemic, assessing the risk level of everyday activities is going to be a daily reality for all of us. So it's important to understand what are considered low, moderate, and higher risk activities. So I will outline general guidelines, but it is important to note that risk assessment is by nature a personalized process and must take into account each person's individual circumstances. So sometimes there are extenuating circumstances that require engaging in higher risk activities. And if so, we should be thinking about how to minimize that risk as much as possible. So with that caveat, generally speaking, low risk activities include virtual programs in your home, packets of materials sent to your home, hiring people who are already within your household to be a service provider, or adding an aide to your household if you can offer them housing so they can become a part of your household. And moderate risk activities include having 1 to 2 staff come into your home on a daily basis and take you out into the community via private transportation. And to minimize risk in this situation, it's important to give staff as many hours as possible to make it as close to a full-time job as possible, because the more clients that staff have, the more risk is involved. So try for as much staff continuity as possible and use precautions such as masks, distancing, disinfection, ventilation, and utilizing outdoor space. It's also important to make emergency plans when engaging in moderate and higher risk activities. And for more information about that, the DVU's excellent webinar on emergency preparedness planning has great resources around that. And then higher risk activities include having transportation come and outside transportation come and pick you up and take you to a day program where there are groups that congregate indoors. So when thinking about risk, it's important to keep 2 things in mind. So first, indoor activities are higher risk than outdoor activities. And if you have to be indoors, ventilating the space as much as possible by opening windows and doors helps reduce the risk. Second, the number of close contacts you have is important. So a close contact is someone you come within 6 feet of for 15 minutes or more. And close contacts include people you live with, the staff in your home, transportation assistance, and aides. So higher number of close contacts, increased time in close contact with any one person, and closer interaction with any one person, including bathing, grooming, toileting, transferring, all increase your risk. Additionally, masks, symptom screens, temperature checks, and disinfection definitely help, but do not eliminate the risk. And then the last step of any risk assessment is thinking about the consequences. So what happens if I'm exposed to COVID-19? This is an important question to ask because per the CDC, most people with intellectual and developmental disabilities are at higher risk of becoming infected. And if you become exposed, you will be told to quarantine yourself for 14 days. You may also get sick, or you may infect your family, your peers, and the support people that you rely on. And if you have underlying medical conditions or are older, you're at increased risk of severe illness. Given this information, I'm sure a lot of you are wondering, well, what can I do with minimal or no risk? And this is a question that all of us are asking ourselves right now. And many people are coming up with incredibly creative ideas. So these are just some ideas here, but there are many more. So setting up a regular FaceTime call, making treats and arts to deliver to friends, having a dinner party where each household cooks one course and delivers it to the other. And there are many, many more ideas. And then another question you may be asking are, what are safer alternatives to group settings? And some of these I already mentioned, but this includes hiring household members to provide services and having a single consistent aide or a small team of people to provide services in your home with precautions, meeting one-to-one outside, an uncrowded place with precautions, taking drives, doing window and drive-by visits. So these are all lower risk activities. And then finally, since it isn't realistic to think that we'll be going back to our lives as they were for the foreseeable future, I think now is an opportunity to imagine something more individualized and included. So don't forget, this can be a time to participate in disability advocacy or political activities, build new skills such as educational, vocational, service, and or volunteer activities, and engage in inclusion and participation activities with non-disabled people. And importantly, you shouldn't have to settle and you don't have to stick with the same providers if they're not adapting to your needs. So programs should adapt to your needs, not the other way around. So I look forward to seeing the creative, inclusive solutions we come up with as a community. Thank you.
That was wonderful. Thank you. That was really, really great. There's a few questions that have come in specifically for you, Brianna, and I know that Brianna's right now on call at the hospital, so there's a chance she's going to need to run off, and hopefully, I don't know which service you're on right now, but you're delivering babies, or what are you doing today?
I'm in the neonatal ICU.
Oh, I knew there would
sick babies, yeah.
Yes, you're going to go hang out with cute babies that need your help. I want to ask you a couple of these questions now, but then if you're able to stay on or come back, please do, because what we found in our previous webinars is that whoever the doctor is on our webinars always gets a huge amount of questions. Sure. So let me ask you a few right now. Is there a way to get a printed list of measures to minimize risk, like more hours for one staff member, hiring someone already in a household? I do not know of that list, although that's a really great idea that maybe we can work with you on, Brianna. Have you seen a list like that?
I have not, but that's a really great idea, and I'd be happy to brainstorm some things and put together something, yeah.
Okay, that's great. Irene is asking, is it really safe to share cooked food between households?
That is a great question. And, a lot of this, we don't have the data that's specifically asking that question. But from what I have seen, I feel like that is a safe activity. If you go and you leave it, it's cooked, it's been cooked. You can kind of, some people have recommended disinfecting kind of the outside or anything that you might be touching. But I haven't seen anything that's advised specifically against that.
The research that I've seen, and maybe you can verify it, when it comes to food, is that zapping it in a microwave for even like 30 seconds destroys any kind of bug that exists on food. And so I'm probably not salmonella, but this kind of thing. So certainly if you're taking food from another source, transferring it into your own cooking equipment or your own plate and then putting it in the microwave for a minute is certainly very, very safe. Wouldn't you say that? It's the same as getting takeout food.
And with most things, I can't tell you that there is zero risk, right? With many activities that we're going to be engaging in, I can't say that there is zero risk, but there's low risk.
Yeah. Ariana's asking, and I don't know if you know anything about this, but that Japan has been keeping their numbers very low on COVID. And do you know what it is they're doing? I mean, they're not the only country. There's a number of countries that have been able to keep their numbers low. What are they doing that we're not doing?
Sure. And, I can't say for any one country in particular, but I think in general, like I mentioned, the countries that have been doing particularly well have been those that, that had shelter in place or quarantine early and had people who sustained that practice, and then also instituted early contact tracing to get a handle on, like, early testing and contact tracing to get a handle on who was infected and who their close contacts were to try and minimize the spread. And so those are the general principles that countries have been using. But I say specifically for Japan.
Mm-hmm. Yeah, and just for me to comment on what's going on in LA County, which is really driving the numbers in the state of California up, is that things are completely out of control here. I can just tell you, living here, there is absolutely no contact tracing happening. My friend got COVID 2 weeks ago and never got a contact tracing call. There is also no enforcement of masks. There's no enforcement on restaurants who are incorrectly, their masks are down to here, and they're not wearing the face shields, which they're required to do. So, we cannot count on other people doing the right thing right now, which is scary and sad. And that means that we have to do the right thing. And this is not going to go away anytime soon, as Brianna said. And so we don't want to scare people, but we want you to be based in reality, which is why we're here to offer ideas, because this is an idea for the long term. Things are not going to reopen in the way they were for a very long time. Certainly not till next year and maybe beyond. And so we need to come up with ways to stay connected to each other and to stay happy as we can be. So what I'm going to do is I want to go on to our next speaker. Brianna, I think you may have another half hour with us, so I might come back to you with a few more questions.
Sure.
Thanks so much. So now I'd like to introduce our next presenter, Amy Westling. Amy is the Executive Director of the Association of Regional Centers and a multi-time presenter for us, and we so appreciate your time with us. And I've asked you to really talk about the opportunities that exist through the state, that regional centers are given a lot of flexibility in providing services to folks, and particularly around participant-directed services. So go ahead, Amy.
Yeah, thank you so much. And every time I hear Judy or someone else give a realistic point of view about how long it's going to be before we get back to life as normal, it kind of makes me reconsider everything I am going to say. I think, when these webinars started, 3-4 months ago now, you know, it was, okay, what are we going to do in the short term? What are we going to do to kind of bridge some gaps while we wait for life to get back to the way it was? And we're beginning to see through the comments that Judy made, but also through what Brianna was discussing, that there's going to be some permanent changes in our lives. And so things are starting to pivot to think about more, what are those permanent changes going to look like, and how are we going to continue serving people? One of the great things that happened as a result of the pandemic was that the Department of Developmental Services issued a lot of guidance that gave regional centers a pretty wide amount of discretion in terms of the services and supports they could provide. Pretty early on, regional centers began to say, okay, if people are no longer going to day program or work or school or daycare, then, you know, I think the initial response was, let's see what we have in our toolbox now and offer people more respite or personal assistance. And then we got to a place where we started thinking about how can, you know, some of the non-residential services be provided in a different way. So you started seeing more remote service delivery, or you started seeing perhaps some day service providers bringing people food from food banks and doing those kinds of things. But what we heard from families, and really just want to commend all the family advocacy that goes on in our state, was that there was still the need for another solution. And part of that came from, as Brianna was discussing, you know, one of the ways that we know that we can help to keep people the safest is to limit the number of people they interact with. And so even though service providers may have been willing to come into people's homes, there were a lot of families that said, you know, I really at this time want to make sure that I'm keeping myself and my family kind of in a closed network, not in a negative way, but in terms of, I want to control, you know, certainly the degree of social access that that I have, that my child or family member with a disability has, just trying to keep that network pretty tight. And if you think about it, these are things that we all kind of did, or the people that were being responsible about this, right? You know, I have lots of friends that I haven't seen in months and months. I haven't seen my grandma in 4 months, those kinds of things, because we made those decisions about how to make everyone's social network, particularly for those people who are vulnerable, smaller. And one of the things that we heard from families was that they wanted an option to have services continue to be provided, but that they wanted the provider to be someone that was either in their family or in their close social network. So a very close family friend, or an extended family member, maybe who lives with them even. And so the way that this was addressed by the department was through what's called a directive. And basically what that means is that Nancy Bargman, as director of the Department of Developmental Services, has the authority to make some temporary rules to allow people to have greater levels of health and safety, and to allow people to have greater access to services during this time. And one of the rules that she issued in her directive dated March 30th, I believe, was around participant-directed services. And if you think about our system and kind of where we are, many of you, I'm sure, are familiar with the concept of the self-determination program, and you're familiar, thank you, Judy, and you're familiar with the concept of the traditional service model, where, you know, where you access services through the regional center, who contracts with service providers who provide staff to provide your services. Participant directed is sort of in the middle of these two. And it really is, provides the opportunity for families and for self-advocates to access services, define services based on their needs, but to plug in friends or family members or somebody else that is well known to the family into actually providing the service. And this isn't a new concept in our world. In fact, in everyday, just kind of the Lanterman Act and the regulations we operate under, there are ways to do this for respite, daycare, transportation, nursing, and day services to a degree already. But there's lots of rules about how each of those works. So for example, in nursing, you can self-direct or participant direct nursing services, but the person still has to be a nurse. It just allows you to hire someone who's outside of a nursing agency to provide a nursing service. So there's lots of rules about how these things work. But for more services during the pandemic, the department has said that you can use participant-directed services. And those are independent living services, personal assistance, and supported employment. And so that allowed people to access these services by selecting someone who was over the age of 18 and that they believe could do the job, and connecting them with what's called a fiscal management service. So somebody that's going to make sure that the payroll and the workers' compensation and all those things are handled. And then that person can provide the service that maybe you would have had an outside person providing to you previously. And some of this is being driven by, like I said, families wanting to kind of tighten up that social network a little bit. But some of it is also being driven by, in the early days of the pandemic, there maybe were times where, particularly in the supported employment world, where we had people being supported by regional centers who worked in essential functions, essential jobs. So they worked at grocery stores, or they worked at Target. And what we saw happening to some degree was that at times their support workers who had worked with them on the job site weren't able to go do that with them. Maybe they had their own children at home who all of a sudden didn't have school, or maybe they didn't feel safe going into those work settings. But we didn't want people to lose jobs. So we wanted to make sure that there was a mechanism to make sure that they could still get the support they need, because nothing would be worse than during a pandemic that then leads to a recession for someone to lose their job at their well-paying job at a grocery store because they didn't have the support they needed. So that was really the intent. And we've seen that through this time, I think one of the things that we've talked about for a long time in this system is that services need to be flexible, and they need to be built around each person's needs and the needs of their family. And we've really seen through participant directed and remote service delivery and some of the deliveries of activity packets and some of the food delivery and all those kinds of things, we've really seen how true that is, that each person's needs are going to ultimately drive what services look like. But we also understand that each person's needs aren't going to be the same today as next year or 6 months from now or even next week. And so as those needs change, we need for people to let us know, let the regional centers know what the need is now, what's the new emerging need. Like I said, in my family, I thought, oh, we can ride this out for a couple months. And now we're starting to see in our own lives, the changes that are going to be needed, because it appears this is going to be a much longer term situation.
Thank you, Amy. There's like 20 questions for you already. Brianna, I just want to I just want to go to you real quick to see what your time that you need to leave. Do you need to leave by 3?
I'm gonna leave at 3 and then and just make sure that everything's okay, and then I might come back.
Okay, so there's been a couple questions that have come in that I'm just going to throw to you, and then I'm going to go to Amy.
Sure, okay.
Loads of questions that she's gotten. Okay, so would you say that are there any preventive measures that you've seen that people can take, like types of food that they consume or hot tea that is proven to combat COVID?
That's a great question, and not that I have seen. You know, there is no there's only one FDA approved medication for COVID, and it's just recently been FDA approved, and it's for very, very severe illness. There's no preventative medications or anything like that that I've seen that's been FDA approved.
I'm glad that this person asked this, because I have seen on Facebook the same kind of myth that keeps recirculating, where people say, if you rinse with salt water, if you take this specific set of vitamins, supplements, I mean, they have this whole cocktail of things, you will definitely not get COVID. And I would love for you to just explain how not true that is.
Well, I mean, for those sorts of things, you know, usually to have the standard of evidence that we need to be able to do those things, you have to go through trials, you have to do, and to be able to prove that something has that kind of benefit or that has that kind of effect. And none of those trials, none of those things that I am aware of have been studied. And off the top of my head, I can't think mechanistically of how that might help. But yeah, at the end of the day, there's no FDA approved or no studies that I am aware of that have shown anything that has any preventative measures like that.
So I'm going to say, that's not to say that people should not be doing things that can help boost their immune system, and to not be in, if it's possible, the categories that make you more likely to have a poor outcome. Things like controlling your, you know, we know that people who are morbidly obese have poorer outcomes. So maybe this is a good time to eat super healthy and to exercise, which boosts your immune system. So I mean, would you agree that people should be focusing sort of in those areas? Quit smoking is a good one.
Absolutely. I mean, you know, the CDC has said that there are, you know, they have a list of chronic medical conditions that they say, you know, make individuals more prone to getting really sick when they get COVID. So it's really important to manage those medical conditions and talk to your doctor and make sure that you are managing those medical conditions to the best that you can. And for many of those medical conditions, just the general advice of, you know, eating well and exercising helps your health in general. And you know, I think most doctors would recommend that for anyone and everyone. Yeah.
Great. All right. Thank you. And then somebody's questioning whether it's safe for them to send their son to a one-on-one swim class where the instructor is wearing a shield.
I saw that question, and that's a great question. And to be honest, I'm not sure about swimming. I know that I think all public swimming facilities that I'm aware of have been closed. And I'm not sure if that's just because, you know, they don't want people congregating, or if there's something about swimming in the water in particular that could be dangerous. I don't know. I haven't heard anything to that effect. I'm not aware. I can look it up, but off the top of my head, I'm not aware.
Yeah. You know, I can tell everybody. So I have a son who's 23-year-old with autism, and my son does not have swimming lessons, but he has a trainer. It used to be in a group setting, but now it's a one-on-one, who comes to our backyard once a week, who has a mask on and stays 6 feet away from my son outdoors. And so I believe that is safe. I've heard from others that is a safe activity. You know, the swimming, I would say, if the child who's in the pool is safe, If somebody is 6 feet away from them, then that is a safe activity. But if it requires that swim instructor to be on top of them, it becomes less safe. So the closer you are, the less safe it is. So you have to take those into account.
Yeah, again, it's a matter of, like I mentioned, the kind of general principles of outside is better than inside, and you know, distancing, minimizing your close contacts is really important. So if you can participate in activities that are outdoors and minimize your close contacts, then that's a lower risk activity.
So and for those, a number of people joined us late, and so I want to let everyone know that Brianna has done this really incredible risk chart that's kind of an infographic that is a really good thing, and that we will also make available. We will make her whole presentation available on our coronavirus website starting probably tomorrow. But that particular document, we're going to have, you know, get out on our social media as well, so that people can understand what it means to be in a high risk activity versus a low risk. But sort of the last question for you is a little bit of a repeat of what you said in your presentation. Is a person with intellectual disability and hydrocephalus at higher risk to get infected? And any recommendations to prevent risks of getting infected with COVID-19 when going out in the community? So Mari is asking that was covered, and we are recording this this webinar, so you can go back and watch that. But just to quickly answer that question.
So it's really interesting. So when you look at the CDC website, you know, they say having an intellectual or developmental disability in and of itself does not make you higher risk. But then they do then kind of go through and list different things that might make you higher risk that really overlap pretty closely with intellectual and developmental disabilities, which includes having mobility issues or having difficulty communicating. So the CDC hasn't gone so far as to say, you know, intellectual and developmental disability in and of itself is a high risk category. But many of the things that are associated with intellectual and developmental disabilities makes people at high risk. And that's why I said most people with intellectual and developmental disabilities.
Absolutely.
And then again, oh yeah, sure.
And I'm gonna go to a bunch of questions that came in for Amy, and then we're gonna move on to our next presenter. Amy, Rachel asks, that some people who are not yet able to use virtual services remotely, yet might be able to do so if they have the right training, app, hardware, support, or program, you know, could access it. What assessment services are available or support services are available to help people figure out what works for an individual? Have you been hearing anything that regional centers are funding for this? I actually just heard this come up last night at another meeting I was in.
Yeah, I haven't heard anything about assessment for devices. I imagine that it would be kind of the same type of assessment that's done for adaptive devices in general. I do know that in terms of the cost of the devices and the internet access, because we also recognize that that's a barrier for some people, that there are some communities that have lending libraries, and I've heard that there's talk of finding a way to perhaps incorporate into our waiver, which enables regional centers to purchase things with federal dollars attached, some capacity to help people with that. One, you know, that would be based on income levels is what I've heard, but I don't have a lot of details.
Right. And I do believe that the organizations that are doing the AAC assessments, which stands for Augmentative and Alternative Communication Assessments, and every regional center has a contract with at least one of those kinds of agencies. They, at least on the meeting that I was at last night in Westside Regional Center, the agency that has that contract says we are absolutely available to assist with training on accessing remote learning and remote opportunities. So that's definitely something you should ask your regional center about. Another question comes in around overtime. So the regional center is restricting 40 hours per week per service provider, and they're forcing the client to find another service provider to distribute the hours when they exceed 40 per week. The regional centers are not considering the extraordinary situation and are not making exceptions so that these hours can be increased so that the same service provider offers the services which would make contact with fewer people. It's a great question, and that's and a tough situation. What do you think, Amy?
I'd be interested what service we're talking about, because I think that in
Personal assistance hours would be my guess.
Personal assistance, okay. I'm trying to think through how that would work. I don't know the answer, I will be honest. You know, when we look at personal assistance and if it's being done through the participant directed, there is a set hourly rate. And so whether you can afford to do that for the set hourly rate, even if it runs into overtime, is a question. So I don't know if it's that agencies can't afford to do the overtime, but
and they're not getting reimbursed. So what I've been hearing is that the financial management service agencies that are providing that are paying for these services do not get the time and a half rate when somebody exceeds 40 hours. And therefore, because of that, so here's what I know is that, this is, as much as I love to blame regional centers for everything that's wrong, this is not the regional center's fault. That this is coming from the state. This is coming from the lack of funding that exists in our system, and that there is no authority that regional centers have to say, yes, we will pay time and a half. That funding does not exist. I think this is a really important advocacy area. And one of the things that I can recommend is that you can request what's called a health and safety waiver. And I'm going to let Amy explain health and safety waivers, but to tell you that there's been additional flexibility offered where you usually had to get this approved at the state level, and now you can get it approved by your regional center. So I don't know if you want to explain what that is, Amy.
Yeah, so when I was talking earlier about the directives that Director Bargeman has issued, one of them took the authority for issuing what are called health and safety waivers, which are one of the few tools we have in our toolbox to get around certain rate limitations. So you have to show that a higher rate is needed to accommodate someone's health or safety. And in normal times, that's kind of hard to do in certain instances. But what the department saw was that they were going to get a lot of requests for finding ways to creatively meet people's needs that might cost more during this time. And so they allowed regional centers to approve health and safety waivers. They still have to be approved based on the needs of the person. So it can't just be a blanket, here you go, have a health and safety waiver for the whole system. But traditionally, these waiver requests have to be originated by the service provider. They go to the regional center, who then looks at it and analyzes it, and then they're ultimately approved at the department. What this did was it took that final layer of approval off, but the rules in terms of what could be approved didn't change.
Okay. But I do believe that you could potentially make that case. One more question. There's just a ton of them, but I want to move on to our next speaker. There's a lot of questions. People have asked their service coordinator for participant direction. Their service coordinator's never heard of it. They've been denied participant direction when requesting it. They want to know, can it be used actually for children under 18 and not just for adults? So how do we even request it? So what would you sort of give advice? First of all, yes, it's available to all ages in the regional center. Let me just get that out there. And you can use it for personal assistance and not just on respite for children to go out in the community. But if their service coordinators never heard of it, if they're getting denied, what are their options?
Oh gosh, the thing I would really recommend is that people look at the guidance that DDS has issued on this. And it is available in English and Spanish as well as in a more accessible format. I think they've got it in, let's see, they have it in English, they have a summary, you can listen to it verbally in English, you can watch it in ASL, they have it in Spanish, you can listen to it in Spanish, and it's in Tagalog. And so I would take that piece of paper. Well, if this was normal times, I'd take the piece of paper and hand it to a service coordinator. But I would take the link and send it to your service coordinator, and it's got the nice official DDS logo. And that will help start the conversation. Because if you are working with a service coordinator who hasn't had this request come forward before, they may not know that this is an option, and they may not know what you're asking for. But those pieces that are on the DDS website, and maybe we can ensure that we get those links out to folks. Those pieces explain not only what participant directed is, but what the rules are. So for instance, for a child, so there are rules about that for personal assistance and for ILS, the guidance says that it can't be a parent who's providing the service or a spouse. So, it provides not only that the service exists, but it also provides a good summary of the rules, and that'll help your service coordinator get started. Because that's probably the biggest challenge. It's not that people don't want to help, it's that maybe this is their first opportunity to work with participant directed services. And it really is an opportunity for us all to learn together.
Great. Wonderful. All right, there's 20 more questions, but we're going to move on, and we can always come back to this for sure. So our next speaker, hold on, let me get my speakers list out, is Melissa Crisp Cooper, if my memory serves me. Yes, that's correct. Melissa Crisp Cooper is a writer and a disability advocate. And she also, are you the chair, or I know you serve on the Golden Gate Regional Center's Self-Determination Local Advisory Committee. She's the chair of that. And her communication partner is usually her husband, who's at work today. So I will be reading her statement, and then if you have questions for Melissa, she will type out her responses. Okay. So this is Melissa's statement. Before COVID, I was super active in the community. She lives in San Francisco, just for people to know. I would hop on BART to go to meetings, go shopping, or meet my husband for dinner. Honestly, I miss seeing other people in 3 dimensions and being able to venture out alone. I have been lucky enough to have a project for work to keep me occupied. But I feel like I live on planet Zoom. I love that. I'm going to have to use that phrase, Melissa. Our adapted yoga classes are on Zoom now. These classes are fun and a great way to exercise with a kind, knowledgeable instructor and a friendly group of classmates. I can pass along information about these classes if anyone is interested. I've also attended many webinars, meetings, and joined various online groups. In some ways, having everything online has made participation easier for many people with disabilities. It's definitely easier to attend events on the East Coast. I'm pretty excited about attending a chat with Judy Human for AAC users on July 17th. Again, let me know if you want more info. And perhaps Melissa, you can put that in the chat because I think a lot of people would really be interested. We do weekly Zoom sessions with my husband's family, so lots of quality time with my in-laws, happy face. I've been texting and emailing my friends and family. We also go for walks, rolls around our neighborhood to stay connected to our community. I think it would be fun to start an online book club or host a modified game night. So those are really great, great ideas. And I just want to mention, I just want to give a little more details for Melissa talking about her, this one particular event that's going on with Judy Human. Judy Human sits on a board with Melissa called Communication First. Judy Human's also one of the stars, I guess you would put it, of Crip Camp on Netflix. If any of you have seen that film, it's amazing. And so this will be an opportunity if you're interested in being on this event on July 17th to interact with her personally, and she's just an extraordinary human being. So I really recommend that. So thank you, Melissa. And once again, if people have questions, you can put it in the Q&A and she can type her response, or put it in the chat and she can type her response. Thank you, Melissa. So we're gonna move on now to our next presenter, and that is Kavita Sridhar. Kavita, she is a parent, most importantly, a parent, but also the co-founder and CEO of Pragnya, which is a really wonderful organization in San Jose that provides really great social interactions for children, primarily children with autism, but all different developmental disabilities. So thank you, Kavita, and we look forward to hearing what your ideas.
Thank you, Judy, and I really appreciate the opportunity to be able to share here because, as we all know, unprecedented is a word that we've been hearing all along, and for the incredible service that DVU is offering the community as well and putting this webinar together. So I'm really excited to share what we sort of did. My daughter's name is Pragnya. She's 14 years old, going on maybe 50, I would say. So she's one of the reasons why I do what I do, even as a presenter, even as the co-founder of Pragnya. So can you all see my screen?
We sure can, and it's best if you start, yeah, there you go, perfect. That's perfect, thanks.
Yeah, so what we do at Pragnya, so this, what I'm going to be talking about today is about working with Pragnya. Incidentally, Pragnya is also the name of the organization, and for those who are not familiar, it's a Sanskrit term that actually means mindfulness and staying mindful, so and how to stay connected. So one of the biggest things that I found that COVID-19 did for us is it kind of induced a disconnect from every single thing that she was used to, schools, her neurotypical peers, every other inclusive activity that I was trying to get her involved in. And one of the biggest things that almost every parent on this call can probably relate to is that it brought on anxiety, that feeling of isolation, that claustrophobia, and that stir craziness. It happens to the best of us ourselves. And, this was something that happened with her. And of course, the change of the comfort zone of home going into a work zone where she's expected to, comply with all the restrictions of sitting and attending school classes or virtual Zoom classes and things like that. So, and of course, obviously that translated into some really, really maladaptive and disruptive behaviors, sadness, depression, and non-compliance with a lot of the tasks. Didn't want to do anything because she couldn't adjust to the change. And then of course health complications because she's not able to do the usual activities of swimming, which she really enjoys, which helps regulate her temperament and keeps her on task, and going out and working out at the gym and things like that. So there's a whole lot of other issues, and of course eating to compensate. And we all know how ice cream and cookies and chips kind of sort of are the go-to foods when you're sad and you're lonely. Even if you have mom and dad around, dad's on a call, mom's on a, on webinars and presentations. So it's, and then you have to do what you have to do with regard to work when you're not necessarily at school. So those are some of the things that we felt was a big disconnect when it came to, especially my child, Pragna. And what, when I said thinking with Pragna, what I meant was, I had to come up with a creative solution, but at Pragna, the organization as well, we believe that creativity is more about not just thinking outside the box, but also being able to perceive the world in, and identify different patterns and then make connections between these seemingly unrelated things that are happening around us, and then try to generate solutions that are, driven by more like mindfulness. Like, for instance, in my case, I felt my daughter started having a lot of aggressive behaviors, a lot of disruptive behaviors, self-injurious behaviors, which we'd never seen. So I had to come to the point where I had to come to terms with my own, reactions to her behaviors, in terms of, accepting that sorrow, that helplessness that I was feeling as to how to be able to help her. And then being in the present moment with her every single step of the way. And then, of course, empathy and compassion. So if I were to explain this, I had to literally put myself in her shoes to figure out what are the possible challenges that she's facing. And she's minimally verbal. She has language, but she does not use it functionally. So it was difficult for her to express her angst. Obviously, home is a safe zone. That was one of the biggest things that I felt that at the moment I identified that really helped me along the path with Pragna as my daughter. So what I noticed was that I had to understand that, I had to still maintain that balance between her safe zone and comfort zone. And again, try to see how I could get her to work along the different other expectations of hers, like, attending to school or do teletherapy or speech therapy. And then, of course, the humility to understand that what I perceive as enjoyable was not necessarily what she was deeming as enjoyable in this current moment. And the ego transcendence to accept that not everything that I was thinking was going to be working. So one of the things that what I did as soon as we started this COVID sheltering in place was I tried to get in all the in-person services and keep them in place. The ABA therapy, we made sure that the company was screening their employees who was able to offer ABA therapy. We have a behavior therapist coming. We kept that going. So she had interaction with one other person, a safe interactions. Tutoring service, we made sure that she got to go to a tutor where it was a safe, physical distancing, and everything was being followed with masking, and they were constantly being tested, and at the same time, temperatures were being taken. I also advocated for in-person lessons because she has screen fatigue. She cannot actually connect through a computer. So those are things. And then this is where the regional center really came in handy, where we asked for behavioral respite. And, there were a few, loops to jump through, but we did get that approved with some personal assistance services as well. And of course, crisis intervention, which I was never aware of. We'd really not used it, but, to try to use some tools with regard to how to deal with the maladaptive behaviors. And then the next thing, of course, we explore technology to get the virtual learning going. And then, of course, get her whatever direct intervention services we could through teletherapy through the school district. And this was the biggest thing, which was Pragna, the organization, and is keeping her Pragna connection. So this helped us in reconnecting her. So what is the Pragna connection? Well, one of the biggest things that we do at Pragna is we train neurotypical children and adults to be allies of individuals who are neurodiverse through our specific ally support program that I talked about before. So one of the biggest things that we did was we took technology, and we used it, and we talked to our allies, and we built something called a Pragnya Social, where the kids get to meet, spend time together, laugh, share jokes, also sing, dance, whatever they were doing. They were able to continue with that particular aspect. Every single week, they meet every Friday, and it became something for her to look forward to, and something that was a continuity of her comfortable activities that she really enjoyed doing, which was singing and dancing. We added something called an online skills academy, where I'll show you towards the end, I'll show you some small snippets of videos and photograph, where they all learn to sit down, and all the allies and their the neurodiverse peers, all of them sit down and they draw something like a Pikachu or a teddy bear or whatever, make Father's Day cards and different things. Every single Sunday they meet. That's another opportunity for them to meet via Zoom, the Planet Zoom, which I really liked what Melissa shared. And we also established something called a Pragnya Connect call. Now, many of us have the liberty and the luxury of being able to FaceTime a friend, FaceTime somebody. A lot of our neurodiverse friends don't really understand how to FaceTime. My daughter doesn't know how to use a phone and call somebody. She really doesn't engage. But through the Pragnya Connect calls, what we did was during the week, midweek, we make sure that our neurotypical allies, their peers, very close in age, will be facilitated on a call to be able to connect with their neurodiverse friends. So they get to spend 5 to 10 minutes every week talking about something that's of interest to them, how their week went, and they share. And it's just an absolutely beautiful feeling to see individuals sharing. And of course, one of the in-person that we have now started is the My Pack, which went Zoom as well, which went online too, where we have our young adult program. This is called the Pragnya Ally Circle of Kindness. And basically in this particular thing, we go out physically distancing, we go out on hikes, we try to do walks, we go to the beach, we do different things as part of the Pragnya My Pack. Did I face bandwidth issues? Yes. One of the biggest issues that we faced was with the school district. That's a never-ending situation where we finally, I'm very proud to say that we did at our school district manage to lobby and get some hybrid in-person sessions, which are socially distanced and with one-to-one time with the teacher, where they get to work on their IEP goals and they'll get to work on that. Regional centers, what were the bandwidth issues? Well, again, I still have some questions for Amy probably at the end of this, but I was, with some escalation of the matters to supervisory levels, we were able to get Pragnya the behavioral respite as well as the personal assistance. And it has been really, really helpful to have even the crisis intervention in place. Now, that being said, the support services, some bandwidth issues is crisis intervention, the START program that we have. We don't know how really it works, but the fact that it is in place and I have somebody to call, and they gave me some tools like, making her visual schedule and things like that, that really helped at the end of it all. And one thing that I did realize is how to deal with these bandwidth issues is using wisdom skills, that empathy, the fact that I have to be mindful and compassionate, and also using advocacy skills, constantly advocating at every level, not just for my child, but also the kids in the Pragnya program or her peers in school. And also being resilient, not giving up. So we have a saying at Pragnya that we literally have to go to war to maintain the peace for our kids. So, and the whole thing is we wouldn't have been able to do any of this had it not been for all the wonderful allies, the families, the neurodiverse families, and all our allies in every front. So we say together is always better. So get Pragnya, get mindful, get awakened is what we say. I just want to share these 3 small little clips with you before we go. This is one of our virtual socials. This is a 3.5-year-old autistic who is connecting on the virtual call in dancing. And oh, I did this already. The next one is This is them singing together. They're singing the song Count on Me with their allies. And then of course, this is the Skills Academy, which I talked about, where these are the different kids. And this is, of course, my daughter, Pragnya. And somebody who never connects on a computer lesson. When you have a compassion and you have something that engages them and they see their other peers, they're able to do what needs to be done. So that's pretty much what I wanted to share about what we do at Pragnya and how we've been able to support Pragnya.
That's so amazing. You know, there's a bunch of questions. I'm going to go to our last presenter that I'll get to you, but it's so amazing because we had on a webinar a few weeks ago an organization in Southern California called the Friendship Foundation, which has their version of allies. And we know there's best buddies out there. We know that there are ways to connect with neurotypical peers for our children. And so I think it's really important that all of these resources are available now, because we don't have to be in San Jose to take advantage of Pragnya. We don't have to be in Los Angeles to take advantage of the Friendship Foundation. And so we have put some of these resources up on our coronavirus website, but I'm actually going to talk to Ed after this and realize that we should have a whole set of resources because Kavita, you would be very open to anyone from around the state to join in your program, right?
Absolutely. We in fact have two allies who join us from New Jersey, and also we have neurodiverse individuals joining us from Ohio and also from Chicago. So, you know, we're able to, that's one thing good that's come of COVID. Like
that's about it.
Yeah.
That's it. The one thing.
Yeah.
That's great. Thank you, Kavita. All right, now I'd like to present our last presenter. It's two presenters. I first want to introduce you to Joseph Medors, who is a self-advocate, who's going to talk to us about some of the ways he has stayed connected with the world. And working with him is Ann Werner, who's from the STEP agency in the Sacramento area. Thank you, Joseph and Ann, for joining us. Go ahead.
Thank you. Is Ann there?
Ann, you're still muted, Ann.
There we go. Can you hear me okay, everyone?
We sure can. Go ahead.
Hi. Thank you so much for having me. I'm with you, Joe.
Yeah, I'm here.
You want to talk a little bit about
Okay. I want to talk about a little bit about a couple of things. How I'm staying safe with I'm going to talk about how I stay in contact with my family. I got an aunt who lives in Colorado. I talk to her at least twice a month, check in with her, tell them their lives still kicking, and just looking forward to see you at Christmas time. So just talking to her and to keep the peace, and so she won't worry about her nephew. So before this all happened, we had a good relationship already. But I think this made us even stronger since she's in Colorado, and I talk to her quite a bit, checking in with her. And I got a brother who lives in Texas, and we talk at least 2 or 3 times a month, just kind of checking in, and sometimes we just shoot the bull. Since there's no major sports on, it's hard to find something to talk about. I mean, we can talk about the news, but who wants to listen to the news if you're going to hear the same old stuff? So we're comparing notes. How's Texas doing, and how's California doing? So I think we're both in competition, and both states are doing pretty bad.
I want to tell everyone too, in the background with Joe is John Linnell, who is one of my job coaches that supports Joe. Since this all started, we've not had gaps in services. We moved forward, obviously in various times. And how we started that was kind of looked at the person holistically, made sure absolutely that everybody had, and everybody means, we call them employers, but actually what we mean is the people we support. We made sure that they all had masks. They all knew how to take care of those masks. We had staff individually train each person how to use the mask, how to take care of the mask. In most cases gave them more than 2 or 3 because sometimes our masks just don't make it. We had one person accidentally microwave theirs, for instance. Hand sanitizer, we just continue to do educational, not only Zoom meetings, but put it in plain language to make it a little less frightening, because everybody was high anxiety. Lots of different things were coming out. There seemed to be a new directive every other day in the very beginning. I unfortunately think people are becoming acquainted with the new normal of trying to get less acquainted with frantic and more educated on COVID-19. The other thing with family and friends is each person that we've worked with, we absolutely worked with them on how to utilize Zoom. Not everybody has a laptop. So we really had to get creative with even doing phone calls and how to teach people how to do group phone calls on their phone. I'll put myself in that. I had to learn how to do Zoom, and I had to learn how to be more technically competent. It was not my wheelhouse either, so it's been a journey in both those venues. One of the things we started was we do a weekly Zoom meeting for different things. And Joe, you could talk a little bit about that too. I'd like you to jump in a second, but what we do now is Zoom. We have a Zoom exercise class that is led by a professional trainer. We also take into account, of course, everyone's overall health and wellness, making sure that medically they are able to participate. And if we're not, we have ILS and or TDS instructors that are with that person that needs to be supported on how to safely do that. Joe, do you want to jump in a little bit on some of those Zoom meetings? You're absolutely fabulous in those.
So STEP has provided meetings 3 times a week with us, and for example, on Tuesdays, it's almost like peer-to-peer. We talk about, a bunch of us are looking for work, and so we're talking about what's going to happen after this is all over, and how each give us some advice and some tips how to be safe and be sure that we are healthy if we're going back to work, because we want everybody to be safe and healthy if they're going to hit the next phase in life. So that's on Tuesdays, peer-to-peer. Like Ann said, we're doing exercise group, and I've been involved a little bit of it, but the exercise is almost like peer-to-peer, that everybody is doing the exercises, how to stay healthy through this process. I mean, I walk twice a day, once in the morning before it gets too hot, and in the evenings when after dinner if it's cool outside. So we do different. And the instructor works with our pace. She doesn't go too fast or too slow.
Yeah.
She knows, and if we need help or assistance, she worked with us somehow, some way, from. There's probably about 5 of us on that. On Thursday, it's another support group that everybody talking, and there's again about 5 people talking, again, just find out how everybody's doing, what they're doing, trying to stay safe and healthy. I mean, it's not a joking matter. Back and back with staying in contact with friends and family, I got a large network of friends, so I'm constantly chatting with them through Facebook, email, or text with my friends. Tell them I'm still alive, still kicking. So they won't have to worry about me, and I don't have to worry about them. So we keep that dialogue going.
That's right.
Mhm.
Thank you, Joe. And what it is it's a creation of a safe place to even talk about things other than COVID. So we also talk sometimes about politics. It really is governed and driven by the people we support. Sometimes behind the scenes, especially Joe, who does a lot of advocacy work behind the scenes, he works with his job coach or myself, and we do a lot of Zoom meetings. And I think that we've gotten pretty competent at Zoom meetings, other than we're on our phones today, right, Joe? We're both on our laptops are not working too well. The other thing I wanted to tell people too is we also had, I had 3 of my staff who had to dial back some of their job coaching duties because of course, COVID impacted our ability to support people who had jobs in the courthouses. So then we had to get creative about what I would do to utilize job coaches and effectively to support other people that they were familiar with in ILS because they were doing TDS stuff. So what we did is we took the entire caseload, divided it up by 3, and then they were to call those people every day, just whoever I assigned them to, just to do a check-in, ask how they were doing, anything that they needed to help bridge them to supports and services with doctors or dentists or family and members. Just to kind of be in a safe place to debrief, and we could get a pulse on how people were doing through all of this. And that was in addition to ILS going out and giving them supportive services. And Joe might go to number 2, which is the safety precautions that we took. We've had ongoing training with staff and the people we support. Again, because sometimes COVID-19 languages and guidelines would change so routinely that we had to keep people as educated as possible and up to speed, and also put it in plain language. We also always kept a line on what's happening with how many masks were needed. We also did dissemination of foods, and I don't know if everyone remembers the grand toilet paper barrage that people did not have, but we had a big storage of toilet paper, and actually I know myself personally drove some toilet paper and provisions and even diapers out to a woman and her 3 children. Steph also even provided housing for a couple of weeks during this COVID time. She's in between housing. So those are the kinds of things that we kind of disseminated in services. The other thing that sometimes is forgotten is pets, making sure that pets had supplies. They were going to the veterinarian. They were being safe. Pets are a big lifeline to a lot of people we support. And so we had to really make sure we included all of that. And on one Zoom meeting, everybody who participated, we had a pet day, so everybody could bring their pet and kind of introduce their pets. The other thing we had to be mindful of is because people were home more, and as they got more competent on using their computers or their phones and had less to do, there was an overspending that started to occur. So people were doing the Amazon game, the DoorDash. And really overspending. And we found that also the scams started to increase. So we really had to get staff educated on being mindful and spotting scams on the internet or on the phone. Again, just to be more protective and supportive and educational of the people we support. And a lot of people lost their jobs and were getting scammed on not only their money, but that there were jobs for them or they could go back. There was a lot of confusion. So we really had to make sure that we also had good communication going on with other advocates in the area. And Joe, did you have any experience of that as well?
Yes. I guess the first 2-3 weeks, I got about 2 different phone calls and an email, this and that. Of course, I knew what to do, but then they I guess they didn't. The first time they didn't really bite it. And the second time when they called, I guess they ran into the wrong person. So I knew what to do and knew how to handle it, and then I reported to my ILS so she can share it with the rest of my peers. I said, be aware that people are making phone calls and scams out there. So when I get them, I'll be sure to report it to my ILS worker so she can share it with her contacts, and then it won't happen to not just to me, to other people out in the area. So another way how I'd be safe was I checked my numbers. And what I mean by checking my numbers, I check my blood pressure, my fever, my blood pressure, my fever, and my blood sugar at least 3 times a day to be sure everything's normal.
Yep.
And since I have diabetes and doing shots, I need to keep an eye on it. Things have changed a little bit. Now I'm wearing a meter on me, and they track my sugar every 5 minutes. I don't have to hook myself, but I still have to keep an eye on it because it just takes, I guess, one spike. So and I have a good relationship with my doctor, same as with my ILS worker or the AC I'm with. They go with me to my medical appointments and be sure that I understand the material's right. It comes back. My aunt, I got a white aunt that she's a little concerned about my health. And she asked about it quite a bit. And when my ILS worker goes with me, at least she has somewhat understanding that when we contact my aunt or email my aunt once a month to give her a report how well I'm doing, it makes her feel, I think, better that I'm all right. I'm taking care of themselves. Everything's gonna be okay.
Thank you, Joseph.
That's great.
That's great. Thank you, Ann and Joseph. Those were really important suggestions. I like that. Checking your numbers. Checking your numbers every day is super duper important.
Since I have diabetes, it has waking me up. I mean, thanks to the AC I'm with and my ILS worker, and I guess the social support I have around me.
That's right.
And so it's crucial to have the right kind of support around you. You can have support, but if it's not the right kind of support, you will fail.
Yeah.
And so I'm thankful for STEP. I'm thankful for my 2 workers, Alice and Job Coach, because I believe we have a good relationship. They can talk to me, I can talk to them. And so that has helped me carry me through. And I have a roommate too There's only one problem with him, but he's a, I said he's a Giants fan, so I give him a hard time about it. And so he's a little depressed because there's no baseball, same as me. But I mean, we talk. It's important for us to have that relationship. We talk, and since he doesn't get out as much as I do, and when I'm out, I do practice and wear a mask, especially if I'm on a city bus or if I'm going to the local mall. I try to wear it pretty much anytime I'm outside of the house.
Mm-hmm. Thank you, Joseph. Thank you. And we have a bunch of questions that have come in, and I want to turn to them before we run out of time. This one I'm going to throw to Kavita as a parent. One of the questions asks, my daughter has a lot of needs, but so do I. Do I have to sacrifice my needs for hers? What are other options? Are there any tools for figuring out a new plan for our family? And I've heard that a lot. I mean, this is a very, very stressful time for everyone in a family, not just for the people with developmental disabilities. And parents need support. They need support in their home. They need to be able to stay healthy themselves, both physically and mentally. So maybe you can have some advice for her, Kavita.
Well, it's absolutely true. Every one of us has our own unique needs. One thing that I do encourage the parent who asked that question is to reach out and connect with the different support systems that are in place. And that's what I did. I expressed my inability to be able to engage my daughter on a computer screen, and for her to not, the district had by default had virtual learning for all students. What about the ones with pervasive needs? What about the ones who will pick up the keyboard and throw it at you? What about the ones that just will sit there and not engage? Absolutely. And what do you need to do? And if there are no solutions, or if the district is not giving you the solutions, come up with solutions is what I figured out. We tried, kept going at it. And eventually, I guess it did succeed. We did succeed to an extent, because we have been able to pull that, especially for students. I'm talking about if the child is in school. And outside of that, I wouldn't have known about the different services at the regional center had I not written to my case coordinator and copied the regional center. I copied the AD, of course, and I said, I'm in this situation. I really don't know what to do. Try to reach out to as many people as possible. At Pragna, we also have a parent support group where you can always come into those parent support groups, share. There are other parents, and there's a wealth of resources. I'm sure DVU, and one of our Pragna parents is part of DVU, and you have such wonderful coronavirus resource information on your website. So the most important thing is ask, and I guess you can try to figure things out. And when it comes to our needs, at the end of the day, you have to be able to, that's one thing that we always insist, that if you're happy, you're able to make another person happy. And self-care is extremely important. Thank you, Kishan, for putting that on the chat. That's why we do this parent support group every Sunday, where we talk about, it's hard on the parents too, and it's hard on the caregivers. So connect and find out what we can do. We play games. We try to do a walk outside. Each of us having our Zoom cameras and walking, and then showing people in the community what we're doing. Just staying connected. I think, I hope that answered your question, but at the end of the day, just dig away and ask away and reach out more than anything else, rather than secluding yourself.
Yeah, and ask for support from your regional center.
Yeah.
Speaking of that, a couple questions for you, Amy, continuing on the road of participant-directed services. So can a client access participant-directed services if they're also receiving respite? Can an additional participant-directed service provider be brought on as a personal assistant that is different than the respite provider?
Yeah, I mean, I think that, what you have to look at is the function of respite versus personal assistance. So respite is to give the primary caregiver a break. And then personal assistance is sort of like IHSS. So if you've applied for IHSS and you have been given a certain number of hours and you need more than that to meet someone's personal care needs, that usually is for personal assistance. So, the most important thing is to be really clear about the function of each service and how they are different.
Yeah, so to be clear, respite is actually fully called in-home respite. And personal assistance, you can leave the home and go into the community. So that's why if you're getting if you're a parent of a child and you're getting respite, but you want this child to be able to go to the local park, or you want them to be able to take walks in the neighborhood, that is really, it's important for you to go in and ask for those personal assistant hours. I have another question that came in on participant direction. Could you explain the difference between participant-directed daycare services, participant-directed respite services, participant-directed personal assistance services, and participant-directed community-based training services?
Sure. So the first one was daycare?
Yep.
Okay. So daycare is defined in the Lanterman Act as care that's needed for a person to enable the parents to go to work. Or to, I guess in these times, to work remotely. So it really is tied to periods of time when the parents are engaged in work activity. What was the other one?
The next one was respite.
Respite is, and backing up with daycare. With daycare, one of the considerations is what's the cost of daycare for a typically developing child. So if you have a 5-year-old, the expectation is that the family would be paying something for daycare. So the regional center can pay an additional supplement if it's required because of the child's disability, but the family, unless there's, I think, a financial hardship, is expected to pay the traditional cost of daycare. Respite, as we've discussed, is to allow the family member to get a break from the care and supervision needs. So if you want to go grocery shopping and have your child stay at home with a paid caregiver, that would probably be respite.
Great. And then the next one is community-based training service.
Community-based training service. So I mentioned that the DDS directive said that even in normal circumstances, there are participant-directed services. One of them is what's called community-based training service. And the challenge with this service, it came along during the last recession. And the challenge with it is that it is very much like it sounds like. It lets you select a provider that will do some sort of individualized day service with your loved one. The challenge with it is that the rate is exceptionally low. And most of the rates in the regional center system are set by the department, or the regional centers have some ability to negotiate them. But there's a limited number of services where the rate is in statute. So that means the rate is the rate, and that's the law. And the all-in rate for the community-based training is $14.99, inclusive of transportation. So it's really hard to use that service because that's lower than minimum wage in most areas, and that's supposed to be an all-in rate. But that really is kind of, what it's intended to be is if you think about, and Judy, I've heard you describe this kind of what your son does. If you have someone that goes into the community one-on-one with a staff person, this would be a staff person that you selected, probably from your immediate network, to go access parks and in traditional times museums and libraries and those kinds of things. But the real challenge with it is the rate.
Mm-hmm. Got it. Okay. Another question for Melissa. That they've asked again about this yoga program. Would you mind putting it back into the chat again? I know it scrolls up there, but people are very excited about this potential exercise opportunity. Absence billing is literally asked about at every single one of our webinars. And I don't always have someone, and sometimes when DDS is on, I make them answer it, but I don't know, Amy, if you even want to answer, but the basic question is, will absence billing continue to be effect past July 31st? So first of all, most people have no idea what absence billing is, so explain that, and then explain whether you think it'll go past July 31st.
Sure. So absence billing really is, there's a place in Title 17, which is our regulations, that allows regional centers to pay service providers of non-residential services. So those are things, not places where people live. So like day programs and respite and ILS services, those kinds of things. It allows regional centers to pay those providers for their average attendance during times when there's a state of emergency, because we recognize that not as many people are going to use those services maybe when there's a forest fire or there's an earthquake, because people's lives have been upended. And so during the pandemic, because there's a declared state of emergency, this has been an allowable process for the last few months. On June 18th, the department issued more guidance that said that they expect this process to come to an end on July 31st. And that's the latest we've heard on that.
Yeah, I hear that some of the congregate setting providers are arguing that it should be extended. I'm hearing though that it's unlikely to happen since they wanted it to, since the state wanted it to end in the end of June. So if that's in fact the case, you know, we are really strongly urging families who utilize these congregate settings like a day program to go to their day program provider and say, I want to get services from you, but on an individualized basis or in a group of 2 people where we trust the other person and the family that they live in or the place that they live in, that they're not going to spread COVID to my child or to me. And so it is really important for us to think about this long-term solution, because big group programs where people are going to a center where there's 40, 60, 100 people, that ain't coming back possibly ever. And so we need to look at alternatives now for the kinds of services we need to support us during this time and into the long-term future. So people are asking, there's a couple people with kind of similar questions where they're asking, like, my son is doing virtual classes that he loves, but we're having to pay out of pocket for them. Could participant directed services pay for it? Someone else is asking about virtual classes that consumers can take. Would that be covered by participant directed services? Since nothing is really in the community now, it's community based. So, you know, here's my take, and Amy, correct me if I'm wrong, but participant directed services are based on one-on-one assistance. It's not based on a program that you're involved in. So if you're doing like a class online that's exercise, to regional centers, that would be equal to you taking an in-person exercise class, which is not covered by regional center services unless it is inherently part of a program you're already in, like a day program, may be providing that. But if you're a child, you're not going to be in a day program, you're in school. And so therefore participant directed services are not going to pay for that group program. What participant directed services will pay for is an individual to come into your home to do those exercises, or to meet you at the park, or to take you for a walk through the community. So there's lots of opportunities that exist to give the family a break, to give the person the opportunity to get out of the freaking house and to do it safely. So, I really encourage people, pick up the phone or send an email to your service coordinator today asking for participant directed services. You saw in the chat that we gave you the link for the participant directed services guidance on the DDS website. We can put it again there for those who didn't see it. Print it out. It's written in really plain language, as Amy said earlier. DDS has done a very good job on that, and you can present this to your service coordinator if they've never heard of it. You should know that DVU, in addition, our organization is advocating and begging, actually, DDS, the State Department, to train regional centers and their service coordinators on participant-directed services so that when they get these phone calls from families and individuals, they can answer, yes, of course I know about that, and I know how it works. So I don't know if you want to add anything, Amy, or did that work for you?
There we go. Yeah, and the other thing that I would explore, if you find that kind of these remote classes are working well for you, or for your loved one, is that a lot of traditional service providers are doing these kinds of things now as well. And so that may also be an option if you're interested in some sort of remote classes. There are a lot being offered by traditional service providers now too.
So, thank you. It's because we have a question right now. I think it's for Kavita. You had mentioned that you were able to access behavioral respite. This is not something this participant or this person has heard of. Could you explain what that is and how that's different from regular respite? And also, what is crisis intervention? You kind of mentioned all these things.
Yeah. So regular respite is where somebody comes in and works with your child or your neurodiverse loved one, right? In behavioral respite, sometimes your loved one is going to be having maladaptive and disruptive behaviors, and so you need somebody who is more trained to be able to work with them. So this was something that I specifically requested for, and the associate director at our regional center suggested that I get behavioral respite for her, as I was asking for personal assistance, but she suggested that behavioral respite would probably work better because we needed somebody who was more behaviorally trained. So the respite caregivers are given, I think they have to go through a behavioral training module to be able to handle different types of maladaptive and disruptive behaviors, how to get them to, how to keep themselves safe and keep the individual that they're caring for safe as well. Crisis intervention is, it's when you're at in a situation of crisis, like if your child or the person that you're caring for is going after you, or they start indulging in self-injurious behavior or in very aggressive behaviors, they run away. These are different types of crisis that come up. And I had to reach out for crisis intervention services because we were having, we'd never seen that happen ever before. I'm sure Amy would be in a better position to explain what crisis intervention services are, but there's a company that we work with, which is START, and they work with the different systems and supports that are available around us, and they actually provide training and tools. We developed something called a communication chart to talk about what are the what are the tells, so to speak, or what are the antecedents to certain maladaptive behaviors that come in, and what could it possibly mean? And what we did as part of Pragna's person-centered plan, and also what we do for all our individuals who are enrolled at Pragna, the organization also, is we develop a one-page profile, which basically talks about how to be able to de-escalate and how to redirect their behavior, or how to address it, more acknowledging how that behavior is. And that's something that crisis intervention with START, we work with them to be able to provide them that support. Like, they gave us STEM toys. They gave us, they asked us, one thing that I did ask for us was, is it possible for them to pay for a pool? Because she likes enjoying swimming, but not really. That didn't come through, but we did. She likes painting, so they sent me some, or coloring, so they sent some coloring paper and pens and things like that. So, and they also document and keep data on the individual. So in the event there is any, there's unfortunate situation where the police need to get involved, so the crisis intervention comes in really handy at that point.
Thank you. Brianna, welcome back. Did we deliver any babies while you were gone? No, okay, good. So here's a couple questions I saved for you. A lot of people with developmental disabilities live in apartments, in apartment buildings, and so do a lot of families. And they're really worried about those complex hallways, the narrow staircases, the elevators, where people are not wearing masks, and it's impossible to keep a 6 feet distance in a predictable way. What are your suggestions for people? I know that the public health guidelines, I've never seen any guidelines addressing that private apartment buildings should say only, one party, one family, one co-living unit should be on an elevator at a time. And I don't know if you guys have heard the story that just happened in the last few days here in California of a woman who was asking people on her apartment building elevator to put on a mask. And she started getting hate stuff, and there was a swastika in the elevator because they put up a notice saying you must wear a mask. And so people are getting a lot of hate when you have to call people out to wear masks. So any kind of advice, I mean, we're not expecting you to answer the hate stuff, but any sort of advice for people who are living in these apartment buildings to stay safe?
Yeah, that's really difficult. And I know that our spaces have not been necessarily built with COVID in mind, right? And so there are going to be spaces that it's difficult to maintain distance. But again, it is important to try and maintain at least 6 feet of distance as much as possible, and to wear masks. So with regards to elevators, like in the elevators in the hospital, they have big signs on them that say 4 people max, and they have little dots in the elevators where everybody stands, so we can be as distanced as possible. And so I think as much as possible to ride elevators, I think it's okay to say, hey, there are already 3 people in the elevator. I don't think any more people should be in the elevator. And to try and, if it's a narrow staircase, go one person at a time. I think it is pretty important to try and maintain as much distance as possible within the structures, within the spaces we've been given.
Thank you, Brianna. Here's a question that anyone can answer. Melissa, Kavita, Joseph, or maybe Brianna, you've seen it as well. Are there any styles of masks that might be more easily tolerated by people with disabilities? We have tried several masks that attach on the ears. We have tried plastic face shields, and they have not worked. So I'm just going to start by saying, first of all, that the governor's statewide order requiring mandatory mask wearing in public has an exception for people with developmental disabilities. It very specifically says developmental disabilities. That being said, we still want to try to get people with developmental disabilities to wear masks if it is safe for them to do so, because it keeps them safe as well. I mean, part of mask wearing is to not infect others, but it also has some even small measure of protection for you not to get sick yourself. And so we do need to figure out ways to do that. However, if you are an individual or you are the parent of an individual who absolutely will not wear a mask, you do have that out. And I would honestly, I'd print out the governor's order and I'd carry it with you in case you are going into a store or into any kind of place where somebody stops you, and you should be able to show them the order. But I'm wondering, Kavita, Brianna, Melissa, if anybody has seen a mask or something that is available to people that maybe makes them want to wear it more. Go ahead, Kavita.
So there is like a scarf kind of thing that comes up, and that you can, it's a cloth thing. You can make it more like a fashion accessory and express, that's what we try with our daughter. So that's something that you can put on. It goes on like a collar, and then you just put it up. So it automatically stays up. That's one of the other things if they cannot tolerate the thing going around their ear.
Great. Any other ideas, Joseph or Melissa? Joseph, are you okay? You're okay with wearing a mask?
Yeah, I have no problem.
Go ahead.
I have no problem wearing one. I mean, I tell you, I drop it to my chin every so often, just get some air.
Right.
You know, and I have no problem with it.
That's a really great point. When you're at home, when you're in the car with your family, it is shocking to me how many people I see driving down the street with their masks full on, and they're the only people in the car. You don't need to do that. If you are out for a walk and you're nowhere near anyone else, you don't need to have the mask on. So one idea is, if your child is unwilling to wear a mask, is to try to stay in places that are really low populated, or to go out at times with where people are not out, early morning, mid-afternoon. Like if you walk around my neighborhood at 10 o'clock in the morning, it's empty. You walk around sort of 6 p.m., it is packed. It's like the pre or post dinner family walk time, and we're constantly crossing the street to stay away from people. So anyway, one other idea I have, I was hoping to actually physically show it to you, but I don't have it anywhere near me, is that my son's aide made masks for my son with his favorite characters on it. So we have one with, he has one with SpongeBob SquarePants on it. She made me one with Mickey Mouse on it, which is my favorite character. And one, so each of our family members has a mask with a character that my son might be interested in, which makes it like a fun thing to wear it. It becomes, like, it's amazing when you go to Disneyland, a person who hates wearing a hat all of a sudden is wearing Mickey Mouse ears. So let's have it so that people, think it's kind of fun. I also think that there needs to be a behavioral, I'm not a big behaviorist advocate, but I do believe that you can create a protocol for someone to start by wearing a mask at home for 30 seconds and then let them take it off. And then an hour later, they have to wear it for a minute. That you can work your way up and time them so that they can say, all right, now we're gonna go out for a 5-minute walk with your mask on and you can't take it off. And then come home after 5 minutes and say, see, you did great in 5 minutes. Instead of saying, forcing the mask on a person and then throwing them out into the world and saying, oh, you couldn't wear it. And then we're punishing you by coming back home. I think there's really a way to think of it in an ABA context, and I mean that in the best of the way of ABA, that you can work slowly up to that. And I don't think that families are thinking of that. They're just saying, oh, my kid won't wear a mask and we're done. Of course, there are those people who won't wear a mask and it's unsafe for them to wear a mask. But go ahead, Brianna.
Yeah, I was just hoping, could I revisit some previous questions that were asked really quickly?
Sure.
Okay, so I wanted to confirm that there is no evidence that coronavirus is spread through recreational water. So similar to what I was saying before, it's not the water in and of itself or the swimming in and of itself, it's swimming in close contact with people. So again, if we keep kind of the big principles in mind, it's staying at least 6 feet away from people and minimizing that close contact. And similarly, with regards to foods that has been prepared either by a restaurant or somebody else, there is no evidence that coronavirus can be spread through food as long as it's been prepared with those principles in mind, so that the people preparing the food are wearing masks, have washed their hands, have disinfected the surfaces. There's no evidence that coronavirus can be spread through food. So again, it's, you know, there's a lot of these questions, and it's just important to keep the big principles in mind, right? That, you know, as long as you are maintaining distance, wearing your masks, washing your hands, and following these simple principles, you know, it's easy to kind of to sort out what activities are okay and not. And when in doubt, just Google CDC and your question, and there's a lot of information out there. And also ask your doctor.
Great, thank you, Brianna. Amy, I just want to tell you there's a couple of people in the Q&A who are dying to send you an email. So you can either send them private things or put it on there. So I don't know. I generally don't give out my email on these webinars, but you are welcome.
I'm happy to. It's on the internet anyway. So I'll be happy to find one of those questions and throw it in the response.
Perfect. Great. Oh, I just put one of them into answered. So go into answered. I put it in live. And another quick answer question. If we are in a day program, but we found another program that we like better and they are offering things like online that we like to do, can we change? You can change at any time. You absolutely can change at any time. Just because in COVID, we're not in like a standstill. In fact, this is a really good time to think about what are the services we're getting. I mean, I know that there are some day programs who are unbelievably creative and are doing some very cool things with people or providing one-on-one assistance in the home. And then there are others who have closed shop completely. So you want to be able to find the services that are working for you. So here's a question for you, Brianna. Is a face shield sufficient by itself, or should it be worn with a mask?
That's another great question, and I think you know, as much as possible, mask is the first way to go. A face shield is definitely an alternative. Both is even better. Yeah, as long as but the mask is kind of the main thing that the CDC recommends.
Okay, great. Let's see. I'm just trying to see if there's any more questions. Here's just a basic question for you, Amy. Who receives and manages the funds and payments for participant-directed services? Is it direct between the regional center and the person providing the services?
No, it goes through a financial management service. So very similar to the self-determination program, the money goes directly from the regional center to the financial management service, and the financial management service pays the provider.
Can they negotiate the rates on any of these services, or are they set rates?
For the 3 that were added to the, thanks to the department's directive, it is a set rate. And I think I mentioned earlier that the community-based activity is also a set rate.
Mm-hmm. Great. This is we're only going to answer 1 or 2 more because we're running over time. This is a really technical question, but it was asked yesterday on our call, on our STP Connect call, and I want to ask you, Amy, to answer this. If a consumer is on the HCBA nursing waiver, can they still access the participant-directed nursing services, or do they need to change the waiver?
I actually don't know the answer to that. because the HCBA nursing waiver is actually administered by the Department of Healthcare Services. But everyone should have a caseworker who receives that waiver service. And it would be like your CCS caseworker, or there's some new agencies that are managing that now. I would ask them for clarity on that.
We acquired, this is the artist, Mackenzie, who created this, oh, here we go, this super cool mask with SpongeBob on it. So that's one way. Thank you, Mackenzie. She's the artist of the household. Okay, I'm thinking that there's probably only one other. People are asking a bunch of questions about the self-determination program, which is not the subject of this webinar, but I'll just tell you that at this point, DDS did not decide to expand in the budget to expand the self-determination program to people who are on the waiting list. You should know that they can do it at any time. And so we haven't given up, and we are continuing to advocate with them. So keep sending your emails to Nancy Bargman on that one. Just, I guess, a final question I'm going to give to you, Brianna, because we have to have hope. It's just, I mean, when people ask me how we're doing in our family, I say, it all sucks, we're all screwed, but other than that, we're fine. Because I really believe that things are not great. I mean, they're not great for my son who loves Disneyland. They're not great for my daughter who is in college and is not being able to, cannot go back to college in the fall because they're not doing it in person for her. It sucks for our vacation that we were supposed to be on right now. So yeah, it all kind of sucks, but we're also kind of all screwed because people aren't doing what they need to do. So we have to have some kind of hope. And one of them is a vaccine. And we know that that is not your specialty. You're not Anthony Fauci, and we can certainly ask him. But do you think that there's even a chance of a vaccine at all? And what would be the timing that you would think?
Yeah, you know, as you mentioned, I'm a medical student. I'm not a doctor, and so I can't give advice from that perspective.
But you play a doctor on TV.
Yeah, but you know, I will say that there is immense pressure and immense desire for a vaccine, right? And with that amount of drive, you know, people can do really amazing things. And I know that there are many labs out there that are working on a vaccine and are working really hard. And there's a lot of money being funneled into a vaccine because everybody wants it, right? And that's a really big driver. And so I am hopeful that there will be a vaccine. As to timing, you know, I can't say for sure. Numbers that I have heard have been, you know, within a year or two. Those are numbers that I have heard. I can't predict much more than that, but I'm very hopeful that there will be a vaccine. Mm-hmm. Will that mean that life can go back to exactly how it was? I'm not sure, you know, I'm not sure about that, but it will definitely help and move us forward along the trajectory that we're on.
Great, thank you, Brianna. And thank you to all of our amazing panelists, Joseph, Kavita, Amy, Anne, Brianna, and Ishita. Thank you all for being part of this webinar. Once again, we've recorded it. It will be available by tomorrow on our coronavirus resources website. You could also look on YouTube. We have a YouTube channel, Disability Voices United, and you can check on YouTube. We have all of the webinars we've ever had, plus all of our self-determination program connect calls, as well as a couple of little videos that I did about how to make a homemade mask. And you get to see lots of fun things on our YouTube channel. We are not doing TikTok videos or anything like that. It's all informational. But I want to thank all of our panelists. Next week, we are not having a webinar because I'm going on a mini vacation to Yosemite National Park, where we will stay physically distant from as many people as humanly possible and go on lots of hikes and get lots of fresh air. And we will be back in 2 weeks with another webinar, a subject matter to be determined by tomorrow. So thank you all for joining us, and please stay safe out there. Thanks, everybody. Bye.